I'm going to get started. I think there is a small group of us this morning, which is absolutely fine. I actually enjoy it that way. And I want to say good morning to everybody. Thank you for joining us. And I'm excited to actually have a conversation. So as you guys, right now, I think all of you guys are muted. I will stop along the way, and I hope that we can just unmute everybody and have a conversation. I think what a unique position that I've been in over the last 2 or 3 years has been I've been in contact with a lot of professors. And what that means is I've noticed there are a lot of us who are struggling with the similar issues in the classroom. I mean, these are the same issues I've been struggling with for 15 years, going on 16 years. So I hope that this time is really a chance for us as professors to connect and eventually to share ideas. What is it that that PhysioU could do to help make teaching and learning more efficient and effective for you as instructors and for ultimately our students, right? The people that we love so much, the people that we have promised to help them become expert clinicians, to give them a tool to serve the world. Can we do that job well? Can we do it better than we've done before? And so this is a little glimpse of how we've been trying to do this. So welcome to Deb and a few others as you've joined on. This talk is really a case study. I kind of consider it as an evolving case study. Oh, and I just want to introduce a couple more people. Dr. Jasmine Kwan will be on. She kind of helps me keep track of text messages or chats or questions that are coming up. And then Dr. James Sims, I've invited him to join us as well. Dr. James Sims was the president of the California chapter of the Physical Therapy Association. He was my professor, my mentor, and hey, he's seen the apps at work, so I thought it'd be interesting to have him join in this conversation. So thanks, James, for joining us this morning. Okay, so building bridges across the PT and PTA curriculum. So what I wanted to talk about and actually open the floor to was this idea that there are some common faculty challenges to deep learning, and this is the whole impetus of why I have begun to create this resource for students. There are faculty who have emailed us that said, hey, we can't attend, could you record this for us? So I'll be recording this for faculty members who aren't able to attend. And I will also send a link out to you as well when we're done with this meeting. So who am I? I've been a professor here at one university, APU, Azusa Pacific University, for the last 15 years. I'm a teaching and learning fellow at the university, which means I get to spend a lot of time with really smart teachers, people who teach teachers. And it really dawned on me that we find ourselves in this very unique position where we have to be great clinicians, but we were never really taught how to be great teachers. And so this is what I've spent the last 15 years learning about, trying to figure out how to do this job better. I'm also a graduate from the residency and fellowship from Kaiser, Southern California Kaiser, and teach for the residency and fellowship now, as well as the USC Spine Fellowship. And part of what I do in China every year is trying to bring guideline-based content and guideline-based practice into clinicians and trained clinicians in China and try to improve the level of care there. And the last almost 6 years now, we have been developing apps. We have been trying to figure out ways to meet the students with new technology to meet their learning needs. And here at the university, I also chair the Institutional Review Board. So that is also a fun and interesting job that I get to do here. So we just submitted for a platform or educational session that we got approved at the ELC. So we did a big literature review about a lot of this technology and learning in entry-level practice. And I think out of this literature review, one big statement stuck out to me the most. The implementation of technology can enhance learning by making the classroom more active and student-centered. So instead of instructor-centric, which I think many of us have been reading about, experimenting with, switching to a student-centered, conversational, engaged experience for the students, that meeting students at their level of comfort with technology can be the key to the whole puzzle. So I think that's actually quite interesting in terms of this idea that I think technology can enhance our classroom, and yet there are varying levels of excitement, varying levels of expertise that even students bring to the table. And believe me, as someone who's been trying to figure out how to use the apps that I make in the classroom, each of us as instructors have different levels of proficiency or confidence, and I'll share with you little bits and pieces of how we have tried to integrate this into our classroom. So PhysioU is actually a web-based and mobile app-based platform that is completely focused on improving physical therapy education, developing clinical reasoning, guideline implementation. So all of our orthopedic apps cover every single clinical practice guideline that is in JSPT, and we've just filmed all the updates on Friday, and we're generating the data to push into the web. So everything is constantly being updated. We have a whole set of filming this afternoon at 1 o'clock. So we have a lot of cool stuff going on, and we are basically hitting a lot of the low-hanging fruit, things that we think could be learned better or could be augmented through digital media, videos, patterns that can play out instead of chapter by chapter in a textbook. I will share with you, and actually each of you who are attending this webinar have full access to this so that you can check it out, use it in class. We designed it to improve learning, teaching and learning. So the top 3 objectives. First, the first slide actually is really sharing some common faculty challenges. This is just summaries from PhysioU faculty emails that we've been receiving. And then I want to share with you a little glimpse of PhysioU as an evolving case study, sharing ideas and needs, and then eventually sharing ideas and needs. What are some ideas that you have? What are things that you struggle with that we could build to help make learning better? So how PhysioU can support your learning. So let me move on here to some common issues from faculty. So these are emails from faculty saying students want to see every skill before they attempt to perform it. Well, that's reasonable, I think. And believe me, we have phones and iPads sticking up everywhere in the classroom, filming me, and sometimes I don't want everything that I do out in the world to be floating around. So there's this challenge, right? That the pictures, they don't just read the textbooks anymore. They read the pictures, they want videos, and it takes a lot of work to do that. So this is something that I think can be beneficial for us as faculty to have this type of resource already for the students. So the students can now just focus on listening, on watching, on asking questions. They can watch before and after class. This is how our students do it. Another common issue is too many resources, too much information. So between textbooks, YouTube, Google, all of these things scattered, we have attempted to actually bring a lot of these high quality resources all in one place that the students will carry with them in their pocket. The amount of material to cover is always a challenge. I think this will be a conversation for another day, but I do believe that there is some value to the mixed or the hybrid classroom. This is what we've done at APU as more and more programs are doing that. It takes a little bit of work, but I've found it to be extremely, extremely freeing, giving me oodles of time to do other more active engagement activities, things that I can use to develop clinical reasoning. So yeah, the amount of material to cover is daunting, no doubt. And I think along with this conversation, I think all faculty, it's valuable to always reassess how much is necessary and how much becomes overload. Because at some point, the curriculum keeps creeping. PT school keeps getting bigger, more information from everywhere, and before you know it, we can't even get the basic stuff done well. So, and then a last couple, and then I'm just going to open it up to the faculty just to speak into this idea of some of the common issues. Assimilating large amounts of material. So we know that there's too much material. We want them to apply it instead of just memorize it for the test. But it's not that easy to get that done, and especially as our class sizes are growing. So another common problem, all of our programs seem to be growing, and this just seems to make the same problem worse. More people, less instructors. How are we going to get them to assimilate this material? Keeping resources and references current. This is also a major challenge. And meeting multiple learning styles and needs. So let me open it up actually just for a second here. For those of you who are muted, please feel free to unmute yourself. And any thoughts or common issues that haven't been mentioned here that you see in your teaching that are pretty common?
Hi, this is Bree Reynolds. Can you hear me?
Hi, Bree. Yes, can hear you. Perfect.
I feel like you've hit the nail on the head. I don't think there's anything else. These are the complaints we have all the time.
Yes.
So I don't know if I have anything new to add to it.
Okay, great. Hi, Bree. Hi, Tony. Anybody else?
Michael, this is Dr. Sims. Can you hear me?
Yes.
Yeah, I think your bullets are hit the nail on the head. One of the things I am finding that may help ameliorate some of these issues is, and you had a slide there for a moment that was siloed. It's like, don't wait till ortho to start utilizing this app. I think it's once I get buy-in from the whole faculty in the program, where then they start showing all the way from anatomy, it's application and things that the student then can see the application, and it goes to that permanent learning rather than just learning for the test and move on type thing. That first book they don't read ahead of time. This would encourage them to do that, and I think what it'll be is an efficiency of learning and the organization of learning will assist the student and the faculty to cover large amounts. So it's kind of like one answer to many problems by getting this, but if you can get it early in the curriculum and be able to kind of get conditioned to do it.
Yes.
The new material coming up, it stays current. What resource, the large number of references, for testing purposes, what's it going to be, Dr. Sims, and stuff like that. So those are all challenges that go. And the last one is you met they're meeting the students at their comfort level of technology, but also I think really resistant to some faculty and who are not familiar with the app may be a little intimidated by the technology too. So I think that applies not just to the students, but also meeting the faculty at their level of technology comfort level. So.
Yeah, I think it's a good point. It's actually one of the main points of this particular chat is this idea that some of these resources can access different parts of their brain, can pave the way for some of the clinical courses from day one, which is what we are doing at APU. And yes, also the idea that these resources, I think about my own textbooks, the textbooks that I used to use or am still using in my class. And this is not to discourage the use of textbooks, because I use them. But, it's this idea that textbooks alone and some of the classroom survey data that I will present to you towards the end that we've done on our own students is suggesting that they don't have the textbooks. And honestly, I don't reference the textbook as much anymore. And so the more you begin to use the tool, the more the students use it. The less you use the tool, that means the apps or the textbooks, the less students also use it. So we each have to ask ourselves, how deeply integrated are we to the textbook? And is this how this group of students, one, do they trust that resource? Do they find that it's useful, and are they actually using it because they see us using it? Or are we moving away from that? Anybody else? This is just an open forum here about common issues that we see and face as faculty.
it's Bree Reynolds again. I'll say one more thing,
Sure.
which I think most of these points hit, but it is that I'll finish a class thinking that I have really tackled one particular topic well. Something that maybe in the past I felt like students were missing the big picture.
Yep.
And I think I really got it. And then we get to the end and some of the questions that are asked or some of the performance on exams, I think, wow, I didn't do it. So even though I thought I was teaching it, they're not getting it. And I think all of these bullet points that you have here are part of the problem.
Right. So, you know, it's so interesting. I have tried so many configurations of my class, reiterations of the things that I teach. And yet at the end of ortho, all of a sudden I'm faced with this crisis moment that after all I've taught you, you still don't know how to do a basic evaluation. Like something did not come together and I don't know how to fix it now. And so I think all of these points drive to this bigger ultimate outcome that is multifactorial. I totally agree, Bree. So that is definitely a challenge. And I don't think the apps are the perfect answer. It's not any one answer. We're doing a lot of different things, but I think the apps have been a cool thing that has helped with integration for sure. And I think not only integration, but also I think also organization and information management, I think, is one very key component to this issue. So, okay, so anybody else? Hey, Tony, you are muted. Hang on. Go for it. I got you.
So I have one thought, Mike, and I think most agree with, I definitely agree with all the bullet points, but I'd say most agree with this last one, the meeting multiple learning style need.
Yes.
I feel as if sometimes there are students in the class that, I mean, just like any classroom, where the discussion point or the topic at hand is high level for one student and very low level for another one.
Yeah.
So as far as a common issue, I sometimes have the issue of how much time to spend on a certain topic as far as going into this clinical reasoning or thought process, where, you know, some of the students already grasped that concept, but the other ones have not. So I would say that's one thing where I think that PhysioU definitely is valuable to use as a reference, where they could kind of come up to speed with some of that stuff. I think my other thought too is, as far as to answer your bullet point question this year from Common Issues, is having them do meaningful reflection. I've been trying to do more reflection in class, and I feel like it's a multi-step process to kind of tease out the actual meaningfulness of the reflection with the students, where their initial thoughts are very, very basic in their reflection, where I'm trying to challenge them to put the pieces together that they've missed, but it's kind of a pulling teeth type situation to actually draw out the process. So if you possibly have thoughts on that, on how to make that more efficient during class, I'd be interested in that.
Yeah, absolutely. So I will get to Dr. Rutland's comment in just one second, but to your point, Tony, I'm sure you have enjoyed a renaissance of teaching by having these conversations in the classroom with the students, where instead of delivering didactic information in a nonstop flow of content, you are actually engaging the students' minds, giving them a chance to speak into the conversation, unpacking their thoughts, and then modifying their thoughts with your expertise, right? This is exactly what the PT students signed up for. They did not sign up for another gross anatomy that they also did in undergrad. What they signed up for was an expert who is willing to take my gross anatomy and begin to connect it to some type of clinical relevance, even at the very foundational levels of PT school. So I think part of enjoying our teaching and learning is prioritizing time in the classroom to that very experience. I guarantee every week when I spend my lecture day, so to speak, lecture day with the students, there is an hour at least where we are just chatting about things that they know, things that they thought they understood, things that they have they've created these pre-ideas from their years as an aide or an assistant. those are magical moments that I reserve. Every Tuesday, we start off class like that. Is what do you know about the shoulder? What kind of problems have you seen? What are your thoughts behind how you manage them different? Or what did you see in the past? The way you begin your week with the students, it creates the context in which they are going to engage with you over the rest of the week, for shoulder week, for example, or neck week. And so I think each of us have to figure out, how am I going to prioritize that experience and by that time for myself and for my students, create a protective environment where they can enjoy to speak into their learning. So I think, Tony, that is a critical component of this. You will get better and better at it, and the students will also get better and better at it because it is a consistent experience that happens week after week. So remember, in my next couple of slides, you'll see I believe that there is this shell shock, this deer in the headlights that happens at the beginning of every new term. But what if that didn't have to happen? What if they always came into the classroom knowing that the professor was ready to engage them and mold them? And I don't think every professor needs to do this, but my students know that for the 27 weeks straight that we are going to be together, pretty much every week there is protected time for that to occur. They're getting better at engaging with me. I'm getting better at engaging with them. It's a skill that has to be learned with repetition. So could I invite everybody? I'm going to move on here, unless there's other people who have some comments. Are there any others with comments? Okay, perfect. And could I invite all of you to actually mute your microphones just to make it a little bit easier for everybody to listen? And then once we come to a point where we are chatting again, we can unmute the microphones. Thank you. So Dr. Rutland made a comment, and I think it's very relevant to this conversation. I would also like to comment that we have to challenge students to critically think and not give them all the answers. So true. So this basic first set of apps has been a lot of content that's relatively reasonably organized. That's what we've tried to do. Now, the next round of apps, and actually I'll show you in the Gate app how we've begun to create this critically thinking component. We are in the process of designing the games that now go along with the apps. So the basic content is now organized, easy for the students to access. But I've always dreamed of, how do I pull this information out of their brains in a meaningful context so that learning can truly occur? So just organizing the information really is not enough. I've learned that. We've been using the apps for the last few years. I think it's true. We really need to create more resources that allow students in a safe environment to test the information that they're putting into their brain. So, hey James, are you still on, James?
Yes, I am.
Do you mind muting your mic for me?
If you tell me how to do it.
Okay, and let me just move on here. So what you see, there's James. Let me see.
I don't see anything. It's looking for me.
You should have a microphone at the bottom of your screen that says mute. So, okay, let's see. Okay, so you.
Yeah, there it is.
Oh, okay, perfect. So, as you know, we are all kind of confined to our curriculum. And there's nothing that's going to change about that. Our curriculum has always been starting with anatomy. Anatomy runs in sequentially, or not sequentially, in parallel with range motion MMT, our clinical skills class. Orthopedics comes up in the fall of the first year. And then fall 2, they get hammered with cardiopulmonary and neuro and ortho all happening at once. So literally, what I find is that the students end up looking like this. Every new class is a desperate sprint for survival. New content, new textbooks, new professors. Is that the optimal way for the students to be learning? Or could we begin to build bridges from the early content, even gross anatomy, to begin to shape their mind, get them ready, expose them to content that they can begin to explore? I don't need to save all my magic tricks for ortho class. I've got more than enough magic tricks to teach them how to become a clinician. I have way too much, actually, as most of you would attest. So what we've been attempting to do at APU, we found that, hey, a lot of our foundational content was disconnected from the clinical classes. They learn anatomy. They're not sure why they're learning all this anatomy and this basic physiology stuff and how this all links. So this year we started to build bridges. So our students get our apps. The first day of school, they get the apps. So this resource will follow them throughout the entire program. They don't wait until ortho class to get the ortho apps. So connecting gross anatomy to clinical classes. So we found that this was a great opportunity each week to connect whatever joint they were studying to the palpation, to the range of motion manual muscle testing, to kind of begin to build a bridge. Actually, this is one of our colleagues who said, hey, we're teaching palpation at the same time. Do you think you could film a bunch of this palpation stuff that would kind of fit our class? So that's part of the collaboration that I'm hoping to begin with many of you as we're able or as the need arises. So you can see that in gross anatomy, they're talking about the shoulder. Directly related in the clinical class that's happening in parallel. The apps, we basically filmed bony landmark, observation, a video of how to find it, surface palpation, as well as soft tissue palpation. So we filmed all of that over Christmas, added it to the cloud, and now more faculty and more students can utilize it. So we're connecting gross anatomy to the bony palpation. And also within this app, you can see here, we are tying in these muscles to what they'll be palpating in class. And we also built in these origin, insertion, innervation, and function tables so that as the students leave gross anatomy, this content is always tied into the palm of their hand, right? So we're always building these bridges so they can move backwards or forwards. So you can see here that the apps, this is the range of motion MMT app. It contains range of motion, end feel, manual muscle test, palpation, bony, and soft tissue for all the major tissues. And that will continue to improve as more faculty say, hey, could you add this in or could you add that in? So that's clinical skills too.
I'm going to have the patient in a supine position. I'm going to go ahead and elevate the shoulder to approximately 90 degrees, support at the elbow. I'm going to come in and palpate the coracoid process right distal to that. Now,
so you can see this is Dr. Farwell. He is my wingman in ortho, and he is going through and doing these palpations. Now, the students can watch it or read it or listen to it anytime that they want to, right? That's the magic. It's not the one time that we showed it in class. It's they prepare for this ahead of time and they look at it again later, right? You've just broken through the boundaries of your classroom. So you can see muscle, origin, insertion, innervation here, down here. We've also begun to connect gross anatomy to orthopedics. So we thought, hey, while they're talking about these structures in anatomy, maybe we could connect them to the common patients that they are going to see in ortho, just to make it interesting for them, to give it relevance. So what you see here is on our website, you can see, later I'll show you where this is. This is accessible to all of you, and also PhysioU we basically have created an automated email system. So every Sunday evening, the students know this is only for their learning pleasure. It is not graded, it is not tested, it is purely for them to find interest in what they're learning. So on Sunday, they get this email. Hey, did you want to, I know you're in knee week. Did you want to learn about the common knee pain problems that your patients are going to be having? So they basically click into this link. There's a link to all the clinical practice guidelines that are connected to the app. And also, they can say, hey, I'm kind of interested in knee osteoarthritis. So maybe I'm going to just click on that link, and I'm going to watch this little 1-minute video of this patient who has, a stiff knee and who has a pain above and below the knee joint, and the pain's gradually worsening. And he has a lot of stiffness in the morning, and it gets worse as he goes from transitional movements. He has difficulties with squatting, antalgic gait, limited range of motion. So they're watching this 1-minute video. And I'll get to actually Bree's comment in a second. Yes, but think about this. The students are actually, I have invited them to engage in it if they should so choose. Because secretly what I'm trying to do is invite them into an environment that they can begin to explore on their own. So these optional activities, if they find it clinically relevant to them, that it makes their anatomy that much more interesting, they become engaged in it. So I think this is where we have to begin to think about, are required things done with joy for learning? Or do we just junk them because they don't do the job? Or we think of new ways to engage the students where they begin to get a sense that, man, this experience, when I tried this thing out and I learned about the common pain patterns, and I got to see these types of patients, and it made sense because I had a mom that had knee arthritis and a friend who had an ACL injury. When I begin to see that, man, that makes me more excited to learn about my anatomy. I think that begins the right direction of how we engage students. So to me, it is an effortless, meaning we put some work into building these, but actually the apps take care of it and the automated emails take care of it. So it's no longer squeezing more effort out of an overtaxed faculty. This is automation, right? This is dangling interesting food in front of the student and seeing if they'll take a bite, and them saying, hey, that was a pretty good bite, right? So actually this is completely ungraded. And it also, after we've created the content, which is available to you as well, it takes no major effort on our part. Okay, and next year I'll have better feedback for you about, in general, our students really enjoy it. And we actually did this email blast to all 3 years. The gross anatomy group, the first years, the second years that had just finished anatomy or finished ortho. So I thought they must be bored of me. Why would they be interested in this? And then the third years who are in clinicals. We got feedback from all 3 classes saying different things. First year, that makes my anatomy so much more interesting. Great. And by the way, secretly, I'm like, please play with the app more. Right? Because the more you play with the app, the more you'll be able to unlock what's in there. Then, the guys who just finished with me, perfect. When I'm in ortho, we're under so much pressure to learn the stuff, I'm really enjoying reconnecting with this in this different way. Like, I know when you talk about knee osteoarthritis, what kind of things I would measure, what are the impairments, what are the treatments, all of that's beginning to come back. So I think this is the review side. And then the clinical, when the students are in third year, they've been so removed from the classroom, they're like, oh, it's so nice to reconnect with this information. So I'm thinking about ways to make things sticky, right? How do you make a textbook sticky? Well, it's big and it's trapped in black and white, and it's hard to carry around. But I can get them to engage into these apps anytime with their phones, right? So this is the idea of stickiness. So instead of saying, I want you to be sticky to Netflix, I want you to be sticky to content that helps you to become better clinicians. So here you see on Monday, Wednesday, and Friday. So initially I was overzealous. We were going to send an email every day of the week. Then many of my colleagues and students are like, Dr. Wong, way too much, overload. So I think there's something to be said about that as well. So I said, okay, fine. Monday, Wednesday, Friday, they're going to get a little email. These are short emails. And so they said, hey, this week you're in knee. I know you're probably interested in ACL sprains. So I'm going to send you a little link that says, hey, do you want to learn about ACL sprains? And by the way, I want to introduce you to this guideline-based language that I want to percolate into your brain a little bit. And from there, I want to just connect you to, hey, possible pain pattern. Let's take a look at the structure that you're looking at. And by the way, there's some special tests that you might already know. So I'm connecting with data that they have floating around in their brain. And I'm going to say, you can watch it if you want, or you can make a connection in your brain, and that's good enough for me. Or you can just click into it and see where it lands in the app. Oh, Lachman's test. Cool. So here's some research numbers. I have no idea what that means. Oh, yeah, I remember my CI doing that. Oh, by the way, it's part of an ACL assessment cluster, anterior drawer, pivot shift. Cool, okay. My only goal with this is making a connection with previously known knowledge and inviting them into an environment that they can explore. Because when we hit ortho, it's 0 to 60 in 3 seconds. So I want them to begin exploring early. I want to invite them into these resources early. So that is what we're doing with this particular resource. And so we kind of did, hey, here's a test. Here's kind of a relevant treatment that you might have seen before. And here's a therapeutic exercise that you might have seen also before. So that's all it is. Just drawing connections to things that I want them to think about and things they already know. I don't know. I think from our feedback from the students, this kind of thing keeps them engaged. And it's not a major time investment. It is not in the traditional read it, you will be tested on it environment. It is enjoy learning because I can trickle cool stuff to you along the way. We are doing that, the same thing in gross anatomy. When they get to the chest cavity, we are doing the exact same thing. I want you guys to see the most common patterns of patients that are going to be tied to this cardiopulmonary stuff you're learning in gross anatomy, where you're like, why am I learning this? And I want you to watch a little video of how these patients present in the clinic. So we have that. So they're linked directly to that. Same thing as you saw in the ortho content. And by the way, while we're looking at the lungs, hey, we are going to do a little bit of or assessing breath sounds. So don't worry, you don't have to learn this now, but this is kind of why you're learning about the different areas of the lungs. So, and this is kind of what this, the email that would go out to the students. Again, these are all automated, right? So here's your anatomy content, and here is a link. Here's a link to a video so you can watch some of the tests that are relevant to this condition and the patient and how they present. All of that is automated. Again, they may not know much about it yet. I'm just pre-exposing them and seeing if I can begin to build some breadcrumbs here. Neuroanatomy is the same way. So when they get to certain parts of the brain, certain diseases that we think are really interesting, we are going to connect them via some images and some videos of some testing that might be relevant to this population. So here's some common clinical findings. This should not be more than a 2 or 3 minute visit where the students are enjoying the expansion of the context of what they're learning in the current moment. So they can just click in and watch those videos. So actually, let me take a moment here and see if there are any comments or questions about that. And remember to unmute your mic.
This is Dr. Sims, Michael.
Yeah.
You know, the optional stuff, yeah, unless there's a kind of a grade thing or a quiz to it, you know, like say tell students hold a gun to their head to read it. Well, I think they may take opportunities when they're in the clinic and they have a patient with that condition. They want to go back and get a kind of friendly reminder in terms of osteoarthritis. And so I think maybe, you know, there's always hope for them to go back to those optional things later on when they have, because I think they're all just worried about test scores and is it on the quiz, is it on the
Right.
test. So I think that's where they will benefit mostly from that stuff.
And yes, so in the clinic, they actually revisit the apps a lot from what my students have told us. And also, I think the same comment related to what Bree has mentioned, these optional things, they don't do them very often. But remember that these are not heavily invested, take a lot of time type of things. And I think one of our famous professors at our university says this quote: "They pay me, I teach for free. They pay me to grade." Right? I don't think any of us love to grade. This idea that we need to test everything, I think, kind of ruins parts of the joy of learning. So my thought is, how do I create tools that faculty can leverage that engages the student and sparks a little fire that begins to help them begin to learn on their own outside of my interactions with them, because I just don't have enough time. So someone mentioned, do you require students to purchase the app individually? So fortunately, we built the apps here at the university. All of my students get these for free. This is my gift to my students. But we recognize that students have a very heavy financial burden. So we have constantly are constantly rethinking, is there a single textbook that we don't have to use anymore? That one textbook alone covers the cost of lifetime access to all of these apps. So usually on the web, you can see how many textbooks this covers: cardiopulm, range of motion MMT, gait, ortho, neuro. Any one of those textbooks could easily cost $149, right? So our app is $199, a one-time fee, including all the future PT-related apps. But when the faculty use the educational discount, it's a $99 one-time fee. So all of your students have access to all of this content. The faculty always have it for free. You guys feel free to use it in your classroom. And the students pay a $99 one-time fee for all of this, including all the updates. So we are not trying to increase the burden. We are trying to say, is there one textbook that you wouldn't use anymore? Consider exchanging that for utilizing these apps. Okay, great. So let me move forward. I see your point for use. Many of my optional activities are too gray or too burdensome. This is Bree again. This great comment. This is quick and easy. They click on the social media link, exactly, and they engage in it to whatever level they choose. And I am invested as a professor to create interesting and meaningful things for them. This is how I think teaching and learning was supposed to be. So this is my own little grand experiment of trying to do exactly that. Utilize social media, email, know full well that they don't need to pull out a textbook to engage in this. They just click on a link, watch one video of someone with knee OA, and go, hey, that's kind of cool. I wonder what a hamstring strain is like. I wonder what an ACL instability is like. And boom, 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 their brain is beginning to change, and it cost you nothing. It didn't take any of your classroom time. It's magic. I mean, it's super fun, actually, to rethink about teaching and learning in this way. And I'll share with you later how you can leverage this type of stuff for your students. So you can see all of the cardiopulm lab is built into this particular app. So the entire lab list and all the techniques are built into the physical exam of the cardiopulm app. So if I just took a moment, you can see all of this content is basically what they're going to learn in lab. Even assistive devices. I said, hey, assistive devices team, how much fun is it to read the assistive devices textbook? They're like, oh, it's brutal. It is brutal because you could watch one quick video of how to do a fitting or how to do a gait pattern, and the students would know it. That's it. So we went and filmed all the gait patterns with right leg and left leg affected or non-weight bearing. So we filmed all the versions. And now the instructor says, guys, we are going to work on crutches this week. We're going to learn some gait patterns. I want you to go into the app and pre-look at them. And then we're going to watch them together on the screen because no one can see anything when all 50 of you are crowded around me. And then you take your apps into the classroom and you practice it, right? So the assisted devices app, it's super clean. There's no philosophy built into it. It's just better than the old way. So you have everything from, if you look back one slide, you have everything from how to fit the assisted devices, all the gait patterns with the different assistive devices, going up and down stairs, bed mobility, sit to stand, stand to sit, transfers, wheelchair, everything's there. So, and I think later when you guys try out your access, you'll be able to explore a little and decide, hey, this is useful to me. This would be useful to my students. So I really believe that the apps become a tool for learning beyond the boundaries of the curriculum and learning through their multiple learning styles. And it follows them in their phone, right? I mean, that is the magic of, I could have spent a lot of time trying to build the next Angry Birds, but really what I was hoping to do was, I think we can make the students better and learn deeper and learn over a larger expanse of time than what is too compressed. The risk is our classrooms are a high stress, low time, high risk environment for learning. This is the bottom line. Everything is do or die. Is that a great place to learn? So that is a very important question for each of us to wonder. For example, we have created case mentored evaluations. Mentored evaluations are CIs, essentially. They're clinical specialists. They're all residency trained. Many of them are our alumni. And the students will have a chance to play out everything that they learned from subjective, objective, exam, treatment, home exercise, and patient education. A whole eval on that one patient while 5 of their peers are watching and learning. So the pressure is there, no doubt. But it's in the first quarter, it's completely ungraded. It is purely for the joy of learning, to get feedback, to try it out in a safe environment. And then we gradually increase the risk because there's certain skills we have to see. We have to see an asterisk sign assessment. We have to see a reassessment. We have to see a neurologic exam for a nerve problem. So eventually we add some grade scale, but not till they have had a chance to try it out a few times in a safe environment. All of this stuff that I'm sharing with you is my attempt to create a safe environment that stimulates engagement. So basically, a lot of these apps allow the students to get a 50,000-foot view, right? So they can see all of ortho, everything, even things I haven't taught them yet, played out in patterns. They can see consistencies in the pattern. They can see that when someone has a stiff knee, I expect them to do mobilizations that reduce the stiffness and improve the range of motion. And if they visited the shoulder app, they would see that when someone has a stiff shoulder, I'd expect them to do some mobilizations and exercises that improve the range of motion and reduce the stiffness. They begin to see these patterns are consistent. And so when I'm teaching them new content, they actually have all of this organized in their mind. They can receive that content so much easier. So the clinical pattern recognition app, for example, let me just show you how you guys would log in. So each of you at this point should have, and if you don't have a login, please email me. I'll make sure you get it. So when you go to PhysioU.com, you can see the sign in button. When you click sign in, your email and your password should get you in to the apps. So now you have all of these apps on your computer, and you have, I don't think I've sent you the link yet, but we will if we haven't. There's a PhysioU app in the Google Play Store and in the Android and in iOS store that gives you the exact same access. So you have access on all platforms. So you can see every week. One of the things that I would invite you to consider is a resource is only as powerful as the instructor who is willing to utilize it. So yes, the students will kind of dabble in it, but I use it every week. So every week at the beginning of ortho shoulder week, let's say, I will ask the students, hey, by the way, what are some of the common shoulder problems that you have experienced or you know about? So they'll raise their hands. Oh, I think frozen shoulder. I think rotator cuff tear. Oh, I have a friend. He's a pitcher. He has a shoulder slap lesion. Fantastic. So we're going to talk about the most common shoulder conditions today. Frozen shoulder. So you can see all diagnoses. Frozen shoulder, slap or some type of instability, some kind of rotator cuff tendinopathy, subacromial pain syndrome, and of course you have your very typical AC joint sprain and some differential diagnosis conditions that can cause shoulder pain. And of course your red flags. I know you're going to get that medical screening class later, but I want you to be aware that these are some things to be aware of. So I'm building bridges forward. I'm building bridges backwards towards anatomy because remember, all of these conditions, they already saw a quick video of it in gross anatomy, right? So I've already teased them into this world, this environment. So I'll ask them, hey, by the way, you guys have seen frozen shoulder. What kind of things did you think to do for your... They've already seen this video, right? Clinical findings video. They know that frozen shoulder is going to occur in 4 stages and how the patient looks and how they move. And I have this conversation with them again in Ortho 1 or in my Tuesday class. So we talk about it. We talk about how this patient really can go through phases of lots of pain, but pretty decent range of motion, and then no pain and no range of motion, or very little range of motion. And we'll talk a little bit about, hey, by the way, here is what we would expect you to do for this type of patient who has a mobility deficit. Range of motion assessment, physiologic and accessory. We're going to do this in lab together. And there's always a little clinical reasoning video. It's a mini lecture that I've put for them that kind of makes sense of this examination. And we'll also look at differential diagnosis, movement faults, some common associated impairments like thoracic kyphosis. And we'll talk a little bit about what did you see in the clinic that people would do for treatment. Oh, I saw, MOBs. Great. You have some manual therapy for the highly irritable patient, some manual therapy for the less irritable patient, accessory MOBs, physiologic MOBs, and you have exercises like pendulums. Yeah, you guys saw pendulums before. Perfect. So before I teach them anything, we have looked at the 50,000 foot view. We have organized the content. They're exploring the content. By the time we get to Thursday actual lab where I'm teaching the techniques, they've got it all sorted out. And they're actually watching the techniques ahead of time. It's very powerful. Again, it reduces the deer in the headlights. Every time they engage with me, it should not be deer in the headlights. It should be they have got the background, and now I'm going to use my teaching expertise and my clinical expertise to mold and shape them, right? So that is a glimpse of how I kind of utilize the app. Every week I do it. Every new joint, they can count on me to take them through the app and build the patterns. In the GATE app, you can see that we decided it would be useful. Actually, another professor said, hey, would you create some case studies so that when they're done looking at pathologic gait and normal gait, that I can engage with them with these cases? So we made these little cases. These are real patients. And here's your little case study. Everyone take a moment to look at the case study. And then we are going to watch the video of the patient. So here's some little questions, 24-hour pain pattern. And then we're going to watch some video of the different views. So you have front view, side view, rear view. And we're going to talk about the gait abnormalities that we see. And maybe we can even take one step further and talk about what are the kinds of tests you might do or treatments, even if you don't know anything about it yet. Maybe just engage them. What would you do if you saw limited dorsiflexion, right? So that is our attempt at creating these case studies. We're doing that for cardiopulm, and then the games, I think, will take care of a lot of that. So we're in collaboration with multiple universities, more and more. And, professors are speaking into what we're building. I love it. I love to hear what is it that you find that's different. You know that range of motion manual muscle test, we have had to refilm 1,000 times because everyone's using a different textbook. So that is one of the challenges. And I think what we've tried to do is choose a reasonable middle ground and then create a couple videos that are alternatives that commonly, it's kind of the 0 through 2 manual muscle test grades. People do things slightly different. We're trying to meet the middle ground. It's just a general problem we have in PT. Everybody does something a little bit different. So maybe this will be one step forward where we can actually create a resource that most people find useful and do the job well enough. So we have a lot of different professors. The recent passing of a friend, Dr. Zaruba, who said, hey, you know what? There's a lot of other special tests that I think are important. That you didn't put into your app. Well, we purposely took out a bunch of special tests because we thought too many special tests just creates chaos for the students. But we recognize that they need it for the boards. So Friday night, we filmed a whole slew of special tests and are creating a special test only app that covers all the common special tests. So that's coming. So, and I think, when you think about, if you think about the different apps and how they can engage the students differently. For example, in the GATE app, we've decided that we're actually building a functional movement app as well, based on this entire premise of the GATE app. So, for example, here we knew that teaching students about movement required static pictures. They cannot handle the pace of watching video, right? You have to talk about movement in phases. So we broke it all down so that they could study it this way, to see it on a real body, not just on stick figures. But eventually, we have to evolve them from the basics to observing movement. So here is regular speed. Here is close up, slow motion, right? So you can basically take different views, and let me just get that rolling here. So you can see close up, slow motion, side view or rear view, right? You can see real-time range of motion. You can stop it at any point in the way and say, hey, what is their hip range of motion at this phase? What is their ankle range of motion? And match it to the graph. You can see real-time EMG. So all of this was done with our wireless EMG software that we have. So you can now talk about gait with a human body, with the muscles firing. You remember how, James, when we were talking about how hard it is to talk about muscle activity with these static pictures and these bar graphs?
Yeah.
This changes everything. And to begin to look at the deviations, you don't need to get them to imagine it. You don't have to find it on the web and hope that it's a good video. We're putting it all in the palm of your hand. Every instructor can just pull this up and begin to talk about the associated phase, the cause, the potential penalty. Right? If you think about varus thrust, how hard is it for someone to understand what a varus thrust is? But if you just take a patient and observe it, all of a sudden it all makes sense. Medial joint compartment compression. Here is enlargement of the medial joint compartment. The patient's complaining of stiffness, right? So all of a sudden you begin to change the way they can learn about movement. And now you have these case studies that you can go through with the students. So imagine in the next app that we're building, we've already filmed the bulk of it, forward bend, the phases of forward bend, and what non-optimal or risky forward bend looks like compared to normal or less risky. We don't know what a normal really is. Forward bend, return from bend, sit to stand. That would basically be here. Functional movement app. Here's all the functional movements. Sit to stand, squat, jump, land, right? Forward bend, return from bend. And now you can look at the phases of forward bend, the range of motion requirements, the muscle activity. We don't exactly know even the critical events, but that is what we're building. We are attempting to create a conversation based on some of the data we're collecting. So that will come out. That's going to be part of the next generation of how students learn about movement and why movements can create pathology. If you look at the neuro exam app, you can see pretty much everything you would need, every balance test that you're going to teach. So the instructor's like, hey, we're going to learn about balance this week. Please go in and take a look at some of the tests, these ones in particular. Watch the video, learn about it, learn about how to grade it. Everything is linked to their PubMed abstracts. And that includes all your diagnosis-specific testing. So your Fugelmeyer, your stream, all of that has been filmed for you. So imagine trying to read all of that. Imagine trying to create a binder full of all of this. It's done. We've created it for you so that you could get to the business of taking your clinical expertise and shaping them instead of spending all this time building this content a piece at a time. We've done it all, right? Here's your cranial nerve exam. So neuro is like that. PNF is going to be an amazing app. We actually spent a lot of time building that. Pediatric development is going to be an incredible resource. So I think the future is exciting. Of course, it takes a lot of work. It's very expensive to build these apps. And the very low cost of this one-time fee for the students of $99 is what supports. We pay the patients. We pay for all the filming, the editing, the programming, all of it. This is not a money maker. This is I hope, an enhancement to a bunch of to education in something that I consider very meaningful, something worthwhile doing with my time in my life and the skill sets of many. These are the current apps that we have. So we have assistive devices, orthopedics, cardiopulmonary. These are all clinical pattern recognition apps, so they're all based on patterns. Gait, the neuro class is essentially taken care of in the sense that every single neuro test you've ever needed is all filmed by a director of neuroresidency. Patient education is coming. We're almost done with it. Range of motion, MMT, and palpation. PNF app, we're probably 10% left. We are in the final phases of, we filmed this with an instructor from Kaiser Vallejo. Medical screening app, we are almost done. We filmed this with an osteopathic doctor. We're pretty close to being done with pediatric development. We filmed maybe 15 different babies at different months of their development, and then we're following one baby every month of their first year of life. So we're at month 8. And so now you'll have a resource. Here is this baby every single month of their development and how different things change over time. I think that's how pediatrics can be taught. We are also releasing the special test app probably by the end of the summer. And Dr. Shelley Swen and I are working on our first game, which is wound care, because we know on the NPTE that wound care is universally a bad score. And I think it's not because the content isn't delivered well, it's because they can't play it out. They can't use it. They can't integrate it into their brain. So what better way to do it than create a few games, right? A few different types of wounds. You get to make some choices about how should you debride it? How should you dress it? And you don't do it right, the wound gets worse. You do it well, you get happy faces, unicorns come across your screen, and the patients and the students learn, right? So I think this is my vision of the next round of apps is all going to be game-based. I'm working with Dr. Mark Bishop, also out of Florida, and we're dreaming. We're thinking about how these games can be built. It's going to be fun. It's going to be interesting. It's going to be engaging. So we are also building bridges between CIs and students. On tomorrow and Thursday, I'm running a webinar for CIs who have signed up for our project. We are using these apps in the orthopedic setting, using guideline-based language. We are normalizing, basically. This is the language we use in our program. It's guideline-based. And we are engaging with our CIs to say, Thank you for doing what you do. I want you to have a glimpse of how the language and the theories that we're using in ortho, so that when they come to you, the apps are there for you, you understand the apps, and you also are using similar language with the students. So we're building that bridge, and we are running surveys between with the students and the CIs on how this is helping clinical education. So we'll be presenting about this at ELC at 2008 or ELC in Florida this year. And I just want to close with this, and then we'll just open it up for conversation. I know your time is precious, but I'm open. So just so you know, I have time left over. We are assessing the effectiveness and student experience of integrating these apps. So this is an abstract we just submitted for CSM, a coordinated approach to digital integration across the curriculum. So we want to know, do our students appreciate it? Does it impact their learning? The results generally show that the students have a strong appreciation for a unified platform, something that is consistent across the curriculum, right? Not something new every time you go to a new class. It's something I can revisit anytime on my phone. The use of mobile applications as an adjunct to learning increased motivation, efficiency, and confidence in both the classroom and preparing to enter clinic. Right? So that's good. It's not just a classroom tool. It's a clinical tool as well. I know it's a clinical tool because I teach with it every day in Beijing with the residents and fellows when we're seeing patients. I'm putting them back on track related to a clinical pattern. And students actually prefer a hybrid approach compared to lecture only, face-to-face only, but they continue to value face-to-face. I think there has to be, this is why we came into teaching. We love the face-to-face engagement. But we don't necessarily enjoy just lecturing nonstop content because we have too much to cover. So I think the hybrid approach is the students are responding positively to the hybrid approach. And really, we ask the question, do you buy the textbooks we tell you to buy? The students do not purchase these textbooks. They've come to me to tell me this. So we have to consider that the world is changing, and we have to consider how are we going to meet this next generation based on their learning styles and needs. So, hey, Bree, thank you so much for joining us. I'm just going to open it up here for the last few minutes. Those of you who have to leave, please, thank you for joining us. I will be posting this. But please, any comments? So, please feel free to reach out to me anytime. If you are interested in having your students get access to these apps, please feel free to reach out. We will usually what we do is the instructors say, hey, my students might be interested. Here's a list of who they are. Can you send them your 50% off educational discount? That's $99. And the students can choose to buy it if they want. But I think the most powerful part is really engaging with the faculty and the faculty using it regularly. We have some upcoming webinars. These are we're going to call it PhysioU lunch, the lunchtime nibbles. So these are going to be short glimpses of our professors and how they're integrating these apps into their neuro rehab class, their cardiopulmonary class, their ortho class, or their range of motion MMT class. So be on a lookout for those. I think those might be of interest to some of you. And I'm really thankful for the time that you guys have spent, and look forward to connecting with you more as ideas come up. Please reach out. We're happy to engage and to think about building cool new things. So thank you, everybody, for joining us.
Mike, this is James.
Hey,
Dr.
James.
Sims.
Yep, Dr. Sims.
I'm glad you realized, and there's a comment I had that I wonder if state board exams will reflect this new learning, and maybe it's not new. I know there are, board questions people will say they're writing now in the critical thinking areas, not just the memorization of information. You got that?
Definitely.
Yeah, you got the new special test, app, which is good too. I've seen students in the past have had a plethora of sheets or kind of things to memorize, mock devices, whatever. And now instead, they're a little more nervous going into exam because it's like, well, you don't have to memorize it. You can just rationalize it out and think out. So it's changing for students too, in terms of the way they retain information. So
right. I think from the board exam standpoint, so we're generating a quiz a day type of function where we're going to engage them with questions that are kind of relevant to the content in the apps, because at some point they do have to shape their mind around testing, right? But my opinion is that, and our first time pass rate generally supports this idea that when you are focused on developing clinical reasoning and developing clinicians, passing the boards is not a big problem. I mean, we've had 100% pass rate, first time pass rate for at least a year. This year, we are just slightly under 100% with the change in all the testing. We are not having a problem with our students passing the boards. And I think it's because the way that we teach is focused first and foremost about creating reasoning, helping them understand what is it they're supposed to, the purpose that they're supposed to serve in the medical environment, and teaching them to do it well. And when they can actually develop reasoning, I think recall of content is much easier. But when you try to do recall only and hope that reasoning occurs in the clinic, this is a gaping black hole that we are not sure how the integration is going to occur in the clinic, even though we tend to push it off to that. We tend to say a lot of this is going to come together. It does. A lot of it does. But I think there's a larger role that we can play in the classroom before the students enter the Wild West, where they're going to be treating, we don't know, 20 minutes per patient, 1 hour per patient. What type of patients are coming in, we don't know. But the basic practice patterns, I think we can create an environment in the classroom where they have experienced it, they have seen it in the apps, they see how the examination and treatment and exercises are linked. The development of these basic patterns, I think, help in the long run with their ability to remember stuff, remember content, and apply content in a reasonable way. So I think when it comes to NPTE, I believe that we are approaching the NPTE from a different perspective, and that is how do I build great clinicians first? And I think great clinicians can pass the boards no problem, and that is what our first time pass rate tends to suggest. Granted, it's not just our apps alone. I think we have some phenomenal professors who have been engaged in building these apps, but I think it's part of the clue. How do I achieve clinical expertise and get them to pass their boards? Well, focus first on creating clinicians. Everything I teach them in class, the goal is that it becomes a part of their toolbox, not just a part of their toolbox. It becomes a part of their clinical reasoning, their ability to actually apply this content. And by building that into the entry-level classroom, not hoping or expecting that it is going to perfectly occur in the clinic, I think that helps in many areas. I think their clinical experiences are better because we were very clear and defined about how to treat the basic patterns. And I think when they come to boards, that structure that we built in the classroom, the clinical patterns, that they build on again in the clinic, and that they're going to be tested again on in the boards, all of that should be a building process that is additive and overlapping. Not so much, okay, it's board time, I've got to relearn PT school all in 2 months. I don't think that's the way it was supposed to be. So, yeah, that's maybe the main comment I have related to that. James?
I'll have a conversation with students early in their career academically with, you can pass an exam, that's great. You can pass my class, that's great. You can graduate from this program, but there's no guarantee you'll be a good clinician if we don't start teaching how to be a good clinician. And if we work on making you good clinicians, you're going to have to know the material to pass a test and graduate and pass a class. So if we shoot for that, and that's what this app does. I mean, it really does. And so those students who have come back from clinical go out, I've only gotten stronger, and they almost feel like they go, I think I'm already studying for boards by just using this app and maintaining, permanent knowledge and reasoning rather than just learn and burn and now have a 2-month crush just to get ready for your boards. They already know it.
Right. And I think, James, you have a unique perspective having been my professor, and having been, how many years have you been teaching an entry level?
26.
26 years, you have seen the entire evolution of our profession alone, not just speaking about teaching and learning. And I think if you're able to share, what is your experience as a professor and seeing how this can augment the classroom, I guess. Do you have any? Yeah.
You hit a lot of the points here that I think about, like, from early on, giving them contextual application, all the way from anatomy. I remember early in my years teaching, I sat in an anatomy class, and I don't teach the anatomy class, but I like to be there. It's on the shoulder, which is kind of my area. And the lecturer said, "Oh, we have our shoulder guy happen to be here today," and they asked me a question, and I took about 7 minutes to answer the question, give clinical application, stuff like that. And one of the teachers said, "See, that's why we got to have Dr. Sims here." And the other teacher says, "No, we can't, because we got too much to cover." And I go, "Well, it's efficiency of covering, not just here's the information, memorize it and go." Now, we realize that this anatomy class had a hybrid population. There are other program students in there too, not just physical therapy students. And so, but that's where I hope that the evolution of education continues to go, where they see this from a non-siloed kind of event. And your apps do that, Mark, and Dr. Wong. And so I really much appreciate it. And I think that's where, the early days of my teaching are going to be very different than the latter days of my activities of teaching. And this app is going to be an important adjunct. And the students, and they all come back just excited about what they're doing, because they understand it rather than just what I have to memorize. And they really get to, I think they feel more professional too.
Right, exactly.